Hi, my name is Leo Gill, and I'm the project manager for the Windsor Essex Regional Community Safety and Wellbeing Plan. In this section, I will explain the community safety and wellbeing planning process and review some key benefits to the approach. Community safety and wellbeing planning is truly about creating an integrated approach to service delivery, one that involves multi-sector collaborations and is focused on proactively enhancing and developing evidence-based strategies. All of this is for the goal of addressing local priorities like risk factors or vulnerabilities related to crime and complex social issues. The approach recognizes that the feeling of community safety and well-being goes beyond the incidence of crime. In other words, there are factors that influence one's perception of whether a community is safe, regardless of whether a crime has occurred. This can be stigma, blighted buildings, even a poverty of opportunities in a community. That said, for every risk, there is a community strength, asset, and protective factor. And these should be our starting blocks. So as important as it is to identify risk factors and vulnerabilities, we must also ensure that we identify and build upon the strengths and assets that also exist. Currently, there are phenomenal partnerships happening in Windsor, Essex. Leveraging these partnerships and committees is a critical success factor. We should not be building everything from the ground up, especially when we can support and grow the amazing work that is already happening. Community members are facing challenges to their safety, health, and well-being that are complex and systemic. These challenges can intersect and be exacerbated by other social issues. And just like how these issues can cut across different sectors, so too must our partnerships and our strategies. That means everyone has a role to play, sectors and community members alike. Finally, but most importantly, these strategies must be culturally responsive. We must strive for a process that gives consideration to social and historical contexts and power imbalances. What this means is that we must start with the intent of having meaningful dialogue with individuals and groups from diverse backgrounds. Moving into the Community Safety and Wellbeing Planning Framework, the CSWB Framework identifies 4 areas of intervention. We can intervene through social development, prevention, risk intervention, and incident response. Let's start with incident response. Commonly, when we think of safety interventions, we focus primarily on the center of the bullseye at the incident itself. We tend to approach it from a policing, fire, or an emergency services perspective. But research is showing that more and more often, police and emergency services are responding to situations that are involving well-being and that are symptoms of larger issues, whether it be a mental health crisis, a substance use challenge, or housing insecurity. And despite how well-trained our first responders are across the region, these are issues that they can't solve alone. Let's move up a layer to risk intervention. This layer focuses on reducing harm before it becomes a critical or non-critical incident. These are situations of acutely elevated risk, or situations where, if action does not happen, it will likely lead to harm to self or to others. This is the type of work that is being done by groups like the Situation Table in Windsor, Essex, and situation tables across the province, and usually will involve partnerships between city departments, healthcare, public safety, and community partners. The next layer, prevention, is about proactively identifying and addressing local risks before they escalate. Prevention necessitates the involvement of all people, regardless of their expertise. To think of it in another way, people in a neighborhood or community will be the first to notice when a change, positive or negative, has occurred in their area. They're in tune with their daily environments, and therefore are a great resource to find protective factors and assets to meet that change. Finally, at the top layer is social development. This usually involves longer-term investments or strategies to improve what are called the social determinants of health and well-being, or the underlying conditions shaping daily life. These are, for example, access to income, education, job security, quality housing, and that's just to name a few. Work in this layer involves us looking beyond the incident at really the social causes and understanding that those causes need integrated and collective responses. To pull these concepts together, if instead of starting at the incident as the primary area of intervention, we start at the social development layer, then we can work to build on protective factors and strengths. We can emphasize prevention and risk mitigation strategies through the use of data and evidence-based practice, and ultimately work to reduce our incident response by intervening before challenges become crises. By using the CSWB model, a number of benefits can be found for residents, communities, and the system as a whole. By enhancing communication and collaboration across sectors, we can have a better understanding of priority risks within our community and be better able to address emerging issues as well as connect people dealing with challenges with the proper resources at the proper time. Research has shown that developing and implementing proactive or upstream approaches reduce the financial burden of crime on society, are cost-effective, and have a significant return on investment. For example, a study by Public Safety Canada reviewed the costs associated with the challenges a chronic young offender on track to becoming an adult offender would face. This study broke down multiple overlapping risks, starting even from the family dynamics prior to birth. In total, the costs associated for this one prototypical individual would be about $1.4 million for the entire system. If, however, interventions focusing on acutely elevated risks were used, then the cost of almost $890,000 would be avoided. Furthermore, it was also found that the cost of almost $1.2 million would be averted by even earlier intervention strategies at the prevention or social development layers. To conclude this section, overall, these plans recognize that there are existing strengths and leadership within our communities and across multiple sectors that can be leveraged and engaged to proactively address local priorities related to crime and complex social issues. This is not about reinventing the wheel. By promoting upstream activities and focusing on social development, prevention, and risk intervention, the framework works to stop challenges from turning into crises or incidents. Incident response is, of course, a vital piece of the puzzle, but once again, the goal of these plans is to be proactive and preventative. Ultimately, the nature of this approach, from its inclusion of diverse voices to the identification of priority risks and strengths, means that these plans should be seen as living documents and be built up over time. Considering these points, our plan, while developed regionally, will ensure local priorities in each municipality are identified. I hope you've enjoyed this presentation. For more information, please feel free to visit us at cswbwindsoressex.ca. Thank you for watching.